very much. This is great. I think I was here a couple of years ago and had lots of questions about medical certification. I am sure you guys, this is your ultra favorite topic, right? You're so excited always to make your appointment with your AME, and the purpose of this talk here is to help you kind of navigate, like literally pre-flight your flight physical, so you can walk out with a certificate and avoid PTSD while you're going through that journey. Is it going to be up on the screen? Oh. Yeah, there's something else we need to do here. And then, do I click on what do I do here? Okay, thank you. And by the way, if you have any questions, feel free to, shout out anytime. And I'll stick around during the lunch period if anybody wants to talk about anything personal or a friend of theirs who has questions. Happy to do that. I'm not going to be able to stay this afternoon. I've got commitments with my new grandbaby. But anyway, I'm Petra Illig. I've been doing flight medicine now for 41 years. I can hardly believe it. And I got to tell you, this is the funnest part of my professional career. I used to be an ER doc, and then I worked for Delta for a few years, but this is really the best part of my life. I love working with pilots. It's really funny, a couple of days ago I did a flight physical on a state trooper, and he's like sweating bullets. He's so nervous. I said, really, I'm making a cop nervous? I can't believe that. But it's all good, we're here to help you. So, just kind of overview here, there's kind of three kinds of medicals now with the sports pilot and basic med. There's one that just requires a driver's license, and then basic med, which has been going on now for 10 years, and then of course the FAA certification class 1, 2, and 3. And then I'm sure you're all aware that there's no more student medicals. You might remember back in the day we used to type up a little yellow certificate. That was your first one before you had a pilot's license. That was a combo student medical and a medical certificate. Those have been separated. Student medicals now get a cute little license like your pilot's license, and the medical certificate is separate. You don't even need to be interested in aviation to get a medical certificate. It just means that you meet the standards. So those things have been separated out. So in the sport pilot world now, there's this mosaic component, the modernization of special airworthiness certification. I just look at that as a sport pilot on steroids. Basically, they've expanded the type of aircraft that can be flown. It's no longer based on weight of the aircraft, and it's now restricted to stall speed. And it also allows expansion from the previous 2-seat category to a 4-seat category, simply because there's a lot of airplanes with 4 seats, but it still only allows 1 passenger. So you can use the back seats for baggage. It now also allows retractable gear, manual pitch control, and then I'm not a helicopter pilot, so I have no idea what a helicopter with simplified flight controls means, but that is also now under the mosaic. It does require some training, 20 hours of training and an exam with a CFI, and it only requires a driver's license unless you want to fly night. For a night flights, you need at least a class 3 or a basic med. As many of the other rules, this is not, a pilot is not eligible for this if they've had a previous medical certificate, the most recent medical exam denied, suspended, or revoked. So you have to go through your flight physical process, probably under a special issuance process before you can become eligible again for sport pilot or mosaic. Then the next step up is the recreational pilot. It does require a Class 3 medical, and it's sort of like a private pilot, kind of a little bit limited. It only requires 30 hours of training, written and flight test. You're restricted to 50 nautical miles. Again, you can fly a 4-seater, but only 1 passenger, and no cross-country. But a recreational pilot requires a Class 3. Anyway, I love Lake Hood, and I thought I'd just kind of share some pictures that I've made over the years. So Basic Med, this, like I said, this has been going on since 2016, and it's an alternative to the Class 3, but there's some significant limitations with this. It is not a certificate issued by a civil aviation authority. Therefore, it is not recognized under ICAO, which is that, international regulatory body that allows uniformity around various countries so that a pilot can fly from one country to another under ICAO standards. They have these minimum standards, but these certifications have to come from a civil aviation authority. So Basic Med is excluded from that. That means that most countries don't allow the use of Basic Med, and as far as I know, Canada still has not allowed Basic Med as one of their approved medical, it's not a certificate of medical documentation. There are a few countries, I believe Bermuda allows Basic Med because they want these rich old guys flying from Miami to Bermuda to go spend money. So I believe that's one of the exclusions, but in general, so far, Basic Med is not allowed. Again, the process is, this certificate or this document is valid for 4 years. The pilot does have to take 2 online training courses regarding medical conditions during this 4-year period for the initial documentation, and then 2 years later, and then when they renew again in 4 years. But again, the exclusion is if the airman has had the most recent medical certificate denied, suspended, or revoked, they're not eligible. Plus, in order to be eligible for Basic Med, you actually already have to have had at least 1 flight physical that you passed. So student pilots, they have to do that, and then if they want to switch over to Basic Med in the future, that's okay. Personally, I believe a Basic Med exam is best performed by a person's physician. I feel very uncomfortable for pilots walking into an urgent care clinic or something like that, or their chiropractor or their podiatrist. Now, in some states, those people could perform a Basic Med exam. The rules are that the individual who's performing the exam has to be considered a physician in that state, and it depends on the state rules. Some states consider people like podiatrists or nurse practitioners or PAs, of course, as qualified physicians, and so in those states, even those ancillary kind of people could do a Basic Med exam. So there's not uniformity across the country as to who's allowed to do a Basic Med. But I think, this really should be done by, the pilot's personal physician who knows that person. Because it's really not fair to walk into a urgent care clinic and say, hey, you wanna give me a document that says I'm safe to fly. Plus, a lot of physicians who work within corporations or companies, they don't allow their physicians to do this because there's some significant liability associated with that. When I do a flight physical and I sign off on a certificate, I'm basically saying that that individual meets FAA criteria, unless they lie to me. If they lie to me, there's nothing I can do about that. But I'm just saying that individual meets the FAA criteria as far as I can tell. On the Basic Med, the physician's actually literally signing an attestation that that person is safe to
from a medical perspective. And I think there's a little bit of difference in liability on that. So really it should be done by a physician who knows that person and knows their medical condition. And again, it shouldn't be used to avoid, treatment or appropriate care. Pilots will frequently come in my office and say, yeah, I know I should be on a blood pressure medicine, but I don't want to do it. I don't want to raise any red flags. So dude, take care of yourself first, right? And the FAA certification will follow. And also, just because you have a basic med certificate in your pocket, which is valid for 4 years, doesn't mean that it will remain valid if something happens and something of significance. So in the realm of basic med, it's basically the disqualifying things have to do with brain, heart, and mental health. So obviously, if you've had a stroke, or you develop a seizure disorder, or you've had a heart attack, or you develop, severe mental health issues of any kind, that basic med certificate isn't valid. And that's the same case for FAA certification as well. The other interesting thing is that basic med is processed through flight standards and not through FAA aerospace medicine standards. So the way it works is that the pilot brings what's called a comprehensive medical examination form, which is almost exactly the 8500-8 that you fill out at MedExpress. You just print that out, you bring it to the doc examines, and if they feel you're okay to fly, they sign it, and then you take this online course with the FAA about medical conditions, and there's 2 courses available. One is through AOPA, and the other one is through the Mayo Clinic. And you have to watch it because you can't just turn it on and go do your cooking and everything, because they'll throw in slides that you have to actually validate that you saw that slide with the code. Otherwise, you have to start from scratch. So now for the real meat of the matter, FAA medical certification. I think of this with 3 possible outcomes. The one that we all hope for is you walk in with a certificate and you walk out with a certificate with no restrictions except the limitations usually for glasses or color vision or something like that. And then the middle category, which I'm going to spend a little more time on, is what's called CACI, which stands for Certificates AMEs Can Issue. This is an area that keeps expanding every year. This only requires the AME to review some medical records. Doesn't even need to send it into the FAA, but if they meet criteria, they can issue. And then the third one, which everybody sweats bullets over, is the special issuance. And this is for the disqualifying medical condition that are in regulations, and there's 15 of them, plus any others that are serious enough or significant enough that warrant, monitoring. But the special issuance, because this is for DQ conditions, the AME cannot issue because we're not the FAA. This has to be forwarded to the FAA, and the FAA will review it. And then if the person is eligible, they will issue a special issuance authorization document that allows that person to fly for a limited period of time with a disqualifying medical condition as long as it's stable. The way the FAA handles special issuance is by limiting in time. So let's say you're a Class 3 pilot, over 40, your flight physical only has to be done every 24 months, but they may be, your certificate may be held to 6 or 12-month intervals. And it's saying on the certificate, not valid for any class after whatever date. And if you're not due for a new flight physical, because it hasn't been 2 years yet, all you have to do is provide your updated medical records for that particular medical condition. Usually the AME is allowed to then issue the subsequent certificates, but you can get issued interim certificates. You don't need to come in for a new flight physical until that flight physical is due.
Yours is 2 years.
Pardon me? Did I hear something? Okay. So for all of these things, the key to happiness here is preparation. I can't tell you, how difficult it is sitting in an exam room with a pilot who's like, I didn't know what to bring, and it's like written step by step in their authorization letter. You need a note from your doctor, you need some lab tests, you need this and that and the other. Come prepared and follow that special issuance authorization pathway. But if it's the first time, then you can do a lot of things to come prepared. Call your AME, call your regional flight surgeon. They'll help you with this. And also, new features on the MedExpress, which I'll go over here in a moment, they actually point you to the information that you need, that you can just actually click on the AME guide and get, a roadmap for you. I love this one. It was cold that day. This was about 12 years ago. So, CACI. Any questions so far? Okay. CACI stands for Certificates AMEs Can Issue. This was started, about 10-ish years ago. And the purpose of CACI is to take the workload off of the FAA to look at medical conditions that are really not that significant, but somebody should pay attention to. And a lot of this has to do not necessarily with the specific diagnosis, but the severity of that diagnosis. And there's 28 of them. I could only fit 14 on the slide. But for example, arthritis. Well, there's lots and lots of different kinds of arthritis and lots of different spectra of arthritis severity. I have arthritis. I'm 72 years old. My joints ache, my hip and my knee and etc. But it's not a severe form of arthritis. It's not a crippling form of arthritis. I'm not functionally limited by it. So I would just need a little note from my doctor saying, yeah, she's doing well. She takes a little Celebrex once a day and, doesn't have any functional limitations. My AME would read this note and say you meet the criteria for CACI for arthritis. Don't even need to send those records to the FAA. That's kept in your chart. The AME makes a little note on the application saying meets CACI criteria. That's it. Now, if I had severe rheumatoid arthritis and I needed to be on high doses of steroids every once in a while, and I took 20 Advils a day, that would become a special issuance situation. So it's not just the diagnosis, but it's the severity of the diagnosis. And again, with a lot of these other things, for example, breast cancer. Well, there's breast cancer that the woman has been treated, either with radiation or surgery or a combination, and she's being monitored every 3 months, every 6 months with no metastases. That's a very different type of breast cancer than a woman who has metastases. Because it's not just the diagnosis, it's how bad is it. This one is truly my most common one. Hypertension requiring treatment. It just needs a little note from your doc. What are you on? Any adverse side effects? What's a representative blood pressure? Any other related conditions like diabetes or heart disease? If the answer is no and you're doing well and your blood pressure is well managed, that's all we need. Just looking at, so again, things like the cancers, these are not active cancers. These are not cancers that are getting worse over time or associated with metastases. These are cancers that are sort of in the category of, yeah, you have it, but you've gone through all the major treatment and you're stable right now and we're just monitoring you. And then the next 14, very commonly get a lot of low testosterone folks coming in. There's this whole world now where people can get telehealth and say, yeah, you know, my butt's dragging, whatever else is happening, and they get a prescription for testosterone, usually in a cream or an injection. And that one does require a little bit of lab work because testosterone therapy, for example, increases the thickness of a man's blood. It promotes increased red blood cell formation, and so you need to have a blood test showing that your hematocrit is not too high. Why is that? Because the thicker the blood gets, the more likely for a heart attack or a stroke. But again, if the man is feeling well and your hematocrit doesn't exceed the limit, I think it's 54. Can't remember quite off the top of my head. But then they walk out with a certificate under khaki. PCOS is also a new addition. Prostate cancer is also one that we see a lot of, and this is prostate cancer either in remission, it's been treated, or the person's under watchful waiting. The whole idea about this is that there's no evidence of any metastases. So it's really nice that these conditions have become cakified because it's just so common, and there's really no reason to make a man go through a special issuance system every 6 months if their prostate cancer is well controlled and it's not metastasizing or causing problems. This is a new one. You know, we live in a Ozempic world now, and a lot of people are taking these GLP drugs, not necessarily for diabetes, for which it was originally designed, but for weight management. And I'm not talking just about people who want to lose 5 or 10 pounds. This is frequently for people who have been morbidly obese, and no matter what they do, they can't lose weight in the old system of, you know, there's something wrong with you, you know, just eat less and exercise more. These are really hormonal conditions over which people have no control. We used to have to end up having like bariatric surgery, you know, bypass surgeries and things like that. But now with these medications, they do very well. Doesn't require a lot, requires a note from the doctor. They have to be not flying for at least 2 weeks while they're first starting the medications, because they can produce a lot of nausea and stomach, you know, unhappiness. They have to just make sure that they're feeling well on it before they start flying again. And a little bit of lab tests. The FAA wants to see a blood test showing that your A1C for diabetes is normal. So it's come a long way. It allows, you know, the AME to make these decisions. But the point is, a lot of pilots will come in and say, well, this is what I'm doing, and it's a khaki, so give me a certificate. Please just bring along a recent note from your doctor to help the AME make sure that you do really meet the criteria. Any questions so far about this? Khaki stuff. That was a cold day too. Oh. Let's see here, this is back up. Okay, now this has been in effect for a little bit over a year. And if you've had a flight physical done since January of last year, you may have noticed that the AME did not do a color vision test. So it is no longer required on a regular basis if the pilot had already passed color vision once in the past. So all student pilots have to have this, and then none after that if they've passed. Having said that, so the reason this was done is because if a pilot is sort of borderline, the anxiety is huge for every flight physical. Like, am I going to pass this time, or am I not going to pass this time? And the way that the FAA has allowed this this test to be done generally with the old-fashioned Ishihara color book or in the Titmus machine that you look in. There's a lot of subjectivity associated with that, like how bright is the light that's being shown on the Ishihara book? How long is the examiner allowing the pilot to kind of like, see if they can, get those numbers right? So it's not very standardized, and so that is kind of a problem in having a person doing those tests over and over. So now there are most AMEs are using something called the Wagner's test because it's cheaper than any of the others. They're very expensive, but the Wagner's test is you put it on an iPad, and it's a random number generator, and it's designed to diagnose just about any kind of color deficiency, whether it's red or green, or blue or green, and red, yellow, and all of those various combinations. And it's much more standardized, and it works much better. Now, if a student pilot comes in, or any other pilot who's had a previous color vision deficiency noted on their certificate, they can retake it. And if they pass, then that limitation is removed. The nice thing is the FAA allows the pilot to take it as often as they want. Sometimes, there's a little bit of practice experience that has to go in with clicking on the right buttons, but if a student pilot doesn't pass it the first time, it's not like you're done. You can take it again 2 or 3 times. I've had one young man do it 5 times before he passed.
Wow.
So, but he passed, right? So this is a really neat way. Now, the downside for this, in the genetic version, you're either born with it or you're not born with it, right? Red-green color deficiency is much more common in men. I rarely see it in women, although I have seen it. But it's something that you're born with and doesn't change. But there are some eye diseases that will fade color vision. Optic nerve inflammation, for example. And these are subtle changes. A person isn't going to notice, overnight that, suddenly they can't see the traffic lights like they used to. It's a subtle change and might not be noticed by the pilot. But we'll miss those people because by the time they notice it, the disease can really inflame their optic nerve and destroy things. And you miss an opportunity for early intervention. So that's the kind of the downside to not testing it every time. So new stuff in the world of mental health. There's a couple of new options here for working cases of ADHD and depression. And I would say that a significant number of my young student pilots that come in, man, I can't tell you how many of those folks, especially boys, come in with, oh yeah, I was on Ritalin, in junior high, my teacher told my parents that I was hyperactive, I didn't pay attention, and my doctor said, sure, let's try Ritalin. No formal testing, no formal diagnosis of ADHD, and yet they have this in their history. And now we have to undo it. Do they have ADHD? Did they have ADHD? And now there are options for a fast track, which means that if they had been free of taking medications, I think it's 2 years, it may be 4, I'd have to look that up. There is a fast track for the FAA to review those cases versus the cumbersome neuropsychological evaluations that they used to have to go through. If they're currently taking ADHD medications, they are not eligible until they have stopped for a period of time and then get tested. So that's not the fast track. But if they had this in their history, like in high school or junior high, there is a fast track for it, which really, really helps because these medications used to be, and to some degree still are like passed around like candy. And then adjustment disorder is sort of a specific type of depression I would say almost everybody in this room at some point in their lives possibly had an adjustment disorder. We also call it situational depression. This is what I call the country and western song. You know, my wife left me, I lost my job, my dog died, my truck won't start, and I got fired. And life really sucks. And so you have a hard time getting out of bed, you know, everything is overwhelming. And there are periods of time like this where a person might get prescribed an antidepressant to help their brain kind of get the chemistry going again where they can solve these problems. And this treatment is usually around 6 months, usually less than a year, and this is a normal part of human existence. This is different from a person who's on and off meds, right? Person who's struggling, and then they're doing okay, and then they get their lives kind of figured out, and then 2 or 3 years later, it kind of happens again. That's not an adjustment disorder. That is anxiety depressive disorder, which is not, that person isn't eligible for flying unless they are stabilized on medication for a period of several months, and they're going to stay on that drug. But I could talk for another hour on how that works, because this is another very complicated and somewhat expensive way of getting certified under special issuance. But these are now fast tracks, and by that it means that the AME can't issue, but there's a way that we click on certain buttons to get this into a fast track for review. And those cases are handled much more quickly. Let's see what one is to say. Okay, so there are situations where the AME can issue for adjustment disorder. If this happened more than 2 years ago and no further problems, again, it requires documentation from the AME. And I want to put a shout out for counseling, because the FAA actually is encouraging counseling. They don't want pilots to hide things and get worse and get grumpier and more irritable and bummed out, and because that interferes with judgment. You know, if you feel like shit, you're not going to really do well in the cockpit. So counseling is A-okay. And then there's always this question, well, oh my God, but my counselor is diagnosing me with, you know, depressive anxiety disorder, and now I have this diagnosis. Well, that is a problem, but it's workable. We all know about upcoding. Are you familiar with that term? In order for a physician or a provider or a counselor or a therapist to get paid by insurance, it needs a diagnosis. And so frequently, they'll just say general anxiety depressive disorder just to have a diagnosis for their insurance. And we understand this, and the FAA understands it all as well, and it all depends on what the therapy is all about. And it might require another little second opinion by, you know, a psychiatrist saying, yeah, this is like overdiagnosed. But counseling is actually encouraged by the FAA because they know it helps. Oh, and I think, yeah, so with the new ADD, ADHD fast track, at this point, medications like Ritalin and Concerta, those ADD drugs are not allowed, but the FAA is considering it. So cardiac, this is pretty cool. The rules for having a heart attack and surgery, stenting, angioplasty, coronary bypass graft for class 1 and class 2 hasn't really changed. And I'm assuming most folks here are not in that category, and I'd be happy to talk about that if you want offline. But for class 3, they really have made a huge improvement. So there's no more mandatory waiting period. So it doesn't mean that you can leave the ICU, you know, and come show up for your flight physical. You really do need to have, you and your doctor have to work it out that you're back to to full activities. But there's no longer this 3-month post-stand, 6-month post-coronary bypass waiting period, so the mandatory period has disappeared. It does require an exercise stress test to make sure that all the plumbing, the little blood vessels are still working properly, but it has to be done obviously after your event and your treatment, but within 90 days of seeing A&E. You can't have had your stress test and then you thought a year later I'm going to go get my flight physical. You will need a new stress test at that point. And it requires some other things like, they want to make sure that your cholesterol isn't being managed properly and that you don't have any underlying diabetes, so you need some lab tests. But the FAA is also really focusing hard on modifying your risk factors. What kind of risk factors did you have when you had your heart attack that can be worked on now? Do you need to be on cholesterol-lowering medications? Should you be on a little bit of metformin to help your prediabetes? Should you be on an adequate blood pressure medication? So they really look at that favorably to help prevent the next one. So the other thing is, this is also pretty cool. Even for class 3s, you used to have to every year get a stress test and go see your cardiologist and, just create this big workup that insurance wouldn't pay for because it was not medically required. You don't have any symptoms, you don't have no chest pain, you're feeling well, you're back, to your exercise regime. Why do a stress test? So finally, the FAA has come up now with this simple worksheet that your doctor fills out. And as long as everything is in the yes category, meaning you're doing well, the AME can reissue the certificate. If there's anything in the no category, then now you need a little bit of extra work. But this is huge. This has really simplified things. So, pre-flight checklist. I think when you fill out your MedExpress and you think about coming in for your flight physical, give a little bit of thought. Are you on medications? Probably. Are you on new medications that you weren't on before? That probably needs a little bit extra work. Do you have a new diagnosis? Oh, my doctor said that I could fly with this. Well, your doctor doesn't know about FAA rules. Have you had any surgeries? Have you recovered from them? Have you had any other treatment issues? Have you had any legal issues? DUIs is a big issue in this world. So I always recommend people calling us ahead of time and just kind of spend 10 minutes on the phone so we can get you oriented. But also, when you fill out your MedExpress, there's some cool new features. Isn't that fun? That was 10 years ago. The second plane from the top is my little guy. Or girl. So when you go to MedExpress, and you can even do this as an experiment now, you don't have to fill out a form. If you see at the top now, there's these new tabs, application status, account, help information, and the next slide will show you what the application status looks like. It tells you what the status is of your application if you're waiting to hear back from the FAA. And then I use this every day, Guide for Aviation Medical Examiners, simply because there's always something new in there that I need to focus on. But in this guide, you can literally navigate down to your medical condition. Click on it, and it gives you, the roadmap of what you need to bring to A&E. And so this is the application status. It will tell you, was it submitted? When was it imported, transmitted? Is it in review? What it doesn't show you in review is where in review it is, because is it just opened up by the reviewer in their inbox, or has it really filtered down to, the person who's going to make the last kind of comment? But this is really helpful to people so that they can know what the status is. And I think that's it. So, thank you very much. I'm open for any questions that aren't particularly personal, but I'd be happy to hang out during the lunch hour if anybody has any other questions.
Dead silent.
Yes, sir.
We get a lot of health care and a lot, we have to have, I had a stent placed 25 years ago, so for decades I did that stress test. And this last letter that came out was really, really nice. But finding physicians who want, a lot of times they say, you tell them, I need this test. Say, oh, no, we don't do that anymore. We do this test. And when you get there, that doesn't work. That's bang, you're back at square one. The other is finding what I describe as an advocate. He's not an AME, but he's willing to help me achieve what I need to get to the AME, to get my goal of flying again. And there are doctors out there that are far from advocates. And then there are also doctors that are really tremendous in helping you achieve those goals. Don't give up, find the ones that work.
Excellent comment. We are really lucky in Alaska that our medical community is really tuned into pilots, right? I've been here for 25 years, and I can tell you, if I call the Alaska Heart Institute and say, this is the situation with this pilot, he needs a Holter monitor, they'll say, we're on it. They actually have a tendency to go to the AME Guide website and look and see what is needed. We're very fortunate that way. When I have pilots that come from outside this area, because we do have a lot of people that come here for the summer and then leave for the winter, oh my God, just calling that cardiology office, it's frequently the cardiologist, yeah, we're gonna do an MRI instead of, a stress test. Or we're gonna do a stress echo, we're not gonna do a nuclear study. It's like, well, then you just wasted that pilot's money, etc. Now in the world of commercial pilot, airline pilots, frequently they have options within their company benefit program to pay for those additional things. But yeah, a lot of time it's money out of your pocket. That's why that change in the post-MI thing for the recurrence, not requiring the treadmills anymore, is so big. So advocates, there are a few companies, I mean, I think I'm the best advocate, give me a call. But there are companies like leftseat.com is very helpful. There are other AME offices at high aviation areas, Chicago, LA, Atlanta, of course, that do flight medicine full-time, and they're very helpful. But you're right, I mean, it's like, picking your financial advisor. But that's a very good point, to have somebody to help walk you through it. Anybody else? Yes?
So the basic med, after 4 years, what do you have to do to reinitiate it?
You have to do the same thing. You take a copy of the comprehensive medical exam, which is basically almost exactly the 8500-8 form, but you can pull that off the website, the FAA website, bring that to the doc and say, this is what I need. They do the exam, they sign it. Then you take your online course again, and in that online course, when you're done, it gives you an option to say when you had your physical exam done, who the doctor was, and then Flight Standards knows that. And then that exam is good for 4 years unless you've had a major change in your health. But every 2 years, you have to take another medical course, the online course. So the course you have to take every 2 years.
That doctor, after the 4 years, that doctor is just your GP doctor, it's not FAA?
Not unless you want a flight physical. I mean, some AMEs will do a basic med. I restrict my basic med only to pilots I know who I've taken care of before. I won't do anybody who just walks in off the street, simply because the liability for me is too great to sign somebody off that I've never met before. But yeah, you can hopefully go back to your own physician every 4 years. Sorry, over here.
A friend called me the other day from Petra, Oregon, and said, my son just came in from the Orient, he needed to fly physical, so he landed here in Anchorage and went down to see somebody, some AME for flight physical, who then said, your blood pressure is way out of sight, I'm not gonna reissue your medical, you need to go see the Heart Institute. So he went to the Heart Institute, and they says, oh, there's nothing wrong with your heart. So my friend calls me back and says, now what's he supposed to do? I said,
Come
well,
see me. No.
I think he needs to go see
No.
an AME down where he lives in Washington and start over.
Well, first of all, the FAA is gonna write a letter. Okay, anybody who has been deferred will initiate correspondence from the FAA, and they'll say, we received your application, we were unable to determine your eligibility, and here's what you need to do. They'll probably say, go to your doctor, go have an exam, and if your doctor says this was a one-off hypertension, he was exhausted, or whatever, or he drank too many energy drinks before he came in, or whatever, if the physician says that that person doesn't have hypertension and doesn't need to be treated, or even if they need to be treated, then that letter gets sent in to the FAA, and they'll say, okay, here's your certificate. That's unfortunate. This happens all the time to me. Kind of two different cases. There's those pilots who don't know they have hypertension, and they're like surprised. So option number one, if it's not a student pilot, if it's a student pilot, the AME is only allowed to hold a case open for 7 days. If it's not a student pilot, if they're already certificated pilots, the AME is allowed to hold the case open for 14 days. So a lot of times I'll get people coming in, driving their butts, they've just been around the world, you know, for the last 12 days, they're on their way home to Wasilla, and they're coming in, you know, they're just disheveled, they can't hardly even pass the eye test because they're so tired, you know, and their blood pressure is like 160. I tell them go home, you know, get some rest, come back. Or if it's somebody, we're not sure, do they have high blood pressure or not? Or is this white coat syndrome? You know what that is, right? You walk into a doctor's office and your blood pressure goes way high. I basically have them go buy a blood pressure cuff if they don't have one at home. Take some recordings 2 or 3 times a day for the next few days, call me up, tell me what they are. And if they truly don't have hypertension, we deal with it and they get a certificate. But sometimes they have high blood pressure. So depending on the circumstances, if they can go see their doctor like that day or the next day, get placed on blood pressure meds, come back in 2 weeks, before that 2-week time frame is over, and their blood pressure's fine, they're cacified, they walk out with a certificate. Does that help answer your question?
Yeah, I'll pass that on.
Yeah, and there was somebody else here in front.
Yeah, in Alaska, can a PA do the basic?
Oh,
med-
yes, yeah.
Basic med certification?
Basic med, yeah. PAs can, nurse practitioners can. I believe even chiropractors can. I mean, they're considered, you know, I have to look up again the definition of a physician in the state of Alaska. I'm not sure. I'm not sure about podiatrists, but yeah, there's kind of a, you know, big value, big framework there.
You
Yes.
say nurse practitioners can, but why not see a nurse practitioner for our doctor? She does everything, but she says she can't do the basic med because she's not a licensed physician.
Well, maybe I'm wrong, but I was under the impression that they fall under the state's,
Where,
have to
where is
double
that
check on
written?
that.
Where can you find it written?
Oh, I think we just probably call the professional licensing division.
But she, I mean, her interpretation is she is not.
Yeah, but it depends on how the state handles that. That's why there's such variability from state to state. In some states they are allowed, in some states they're not. I thought Alaska was a little bit more lax, maybe I'm wrong. But that can, I should have checked on that. Anything else? Yeah,
Well, the disqualifications for basic med, are they the same as the FAA?
it's up to, except for certain categories, psychiatric, neurological, and severe cardiac. I mean, that's where it's a gray area, those severe cases are disqualifying, but pretty much everything else, diabetes, which is disqualifying under FAA, you can fly under basic med if the doctor thinks you're well controlled. So it is sort of a difficult area, because it leaves it up to that physician whether or not they think that person's safe to fly. But there are those major psychiatric disorders. I mean, you don't want to fly with a bipolar person, right? Or a person who has epilepsy. And if a person has had a recent heart attack, if they're stable and the doc thinks they're good, and I guess they can do that. They can make that determination. Anything else? Thank you very much. Yes, go ahead.
If you're denied a flight vehicle, can you then go to basic med?
No. You have to undeny it first. You have to go through the steps to get certified under special issuance authorization if that's possible, and that will turn it on again for further basic med eligibility. On the other hand,
How does it work? I was told once to, while you're getting your, say, class 3, to also apply for your basic med while you still have your current certificate.
yeah,
How does that work? That way, if you
Yeah.
lose your current certificate, then you can just.
You can
revert
have
back to
both.
basic med.
you can have both. I don't know why a person would do both, but,
But if you lost your class 3, could you then revert to your current basic med?
unless it's one of those really psychiatric, neurological, but, I mean, if you lost it, or you mean you just expired?
Say expired.
If it's expired, you're good. Yeah, but if it was revoked, you're not. All right, hey, thanks so much, you guys were great. I didn't put too many.